I'm Doc John from Mobility Doc, and I want to talk to you about step downs today. It's an exercise that goes a long way for a lot of us with knee or hip or foot and ankle problems, and I want to explain to you why and give you a few different variations of the step down to get you even more out of it. It's possible that you've done everything you've been told to do, and you've been diligent, you've stretched, you've strengthened, you've foam rolled, you've done yoga, but it just hasn't made the difference for you yet. There's a possibility that step downs may be your missing link. One of the main reasons why step downs are so impactful and important is because they teach your lower body how to decelerate and how to control deceleration. It coordinates better your hip, your knee, and your ankle. Now we're going to go through first the standard garden variety step down, which is a good place to start, and it's where you should start because you're going to want to clear that out first. And then I'm going to give you three more, which is a lateral step down, a forward step down, and tempo step downs. And if you haven't heard of those, definitely make sure you stay with me through the end so that way you see how to do those properly and effectively, because depending on the sport that you do or the activity that you take part in, you may find that one of those other ones might be a better fit for you. And as always, if you wouldn't mind, like, subscribe, share our page, share this post. We've grown a lot, and since before recording this, we've been well over 13,000 now followers or subscribers. So that's been really awesome. Thank you so much for keeping us afloat and inspired to get more of this content out there for all of you. The standard step down, what you're going to need is something to step down from, right? Just as the name implies. I have a gopher mat here so that way I can get a little bit better of a visual. I've also used a yoga block to decrease some of the distance. You might find that you could even just use a yoga block and do these step downs, but for the purposes of being able to see me a little better, I'm up on here, and instead of going all the way down to the ground, I've limited my distance a little bit by putting the step a little bit less deep. So for the standard step down, you're like really focusing on that eccentric braking ability, that sagittal plane quick stop, and making sure that your knee and the integrity of your knee can be maintained. What you're going to do is you could have your hands on your hips, or they could just be at your side, and you're going to step down and up. And what you want to show is that you have the control for the down and the up. If you are moving too quickly, if you're just doing this, it's not right. Like, it's not going to work. Like, you need to be able to control. If you see your knee coming in and out and you're turning while you're doing it, slow it down. If you're going to too deep of a step, and now I'll come over to the side a little bit, and you're committing to this low, but then instead of being able to touch lightly and come back up, you go and you plant, and then you come up, that's not right either. You need to make sure that you can control the full range of motion down and up. So if I were to move this a little bit out of the way, and I wanted to commit to the full distance, now say I've graduated, this is where it can increase the depth a little bit, and I step down and up. And you can see it's a little harder. You'll see a little bit more movement in this leg, all right? Try to hit for about 8 reps. If you can do 3 sets of 8 reps at a specific depth and it's easy, then you can certainly add weight in your hands, one side or the other, or you could just move on to the next version of this. For the lateral step downs, it's a little bit more glute med, glute min, hip stability. It's frontal plane stability. So you might find that for your skiers, your skaters, pretty much any athlete that has like multilateral movement. Now, it's a very similar idea, but if you notice, instead of stepping forward, what you're going to do is you're going to position yourself sideways. You're going to step down and up. So you saw I dropped a little too quickly there, and I don't want to do that. So I need to slow it down. If I wanted to, I could start with the block there. Now, the thing that's really important that I'll show you again from the front is the motion. Say I'm using this left leg. The motion is my knee forward of my toes and down, and my heel needs to stay flat. So heel stays flat, my weight stays through the middle of my foot. I feel equal pressure throughout my foot into the ground or into the mat. As I step down, my knee comes forwards and then I come up. That's very important. If you're doing like this and your chest is dropping and your weight's distributing forward, it's not gonna work. Knee needs to go over the toe. You might find that you need to work on your calf flexibility to help with that. And in another video, we're gonna go over some of that, like how to pair this exercise with other exercises to get more out of it. The forward step down is very similar to the standard step down, except you're going to reach further with the free leg. We're really training anti-rotation. We're trying to stop our body from twisting. What you're gonna do is you're gonna reach out further in front and come down. Now I'm gonna use this step just so that way I have a target. I'm gonna move it out a little bit since I'm going forward with it. And I'm gonna step and I'm gonna reach forward and down. So you can see I'm actually coming out with my foot further and down. I wanna be careful not to extend or arch through my spine. I wanna make sure I'm not throwing my hips too far forward. What I'm actually doing is just making a point of reaching further forward with my foot and here. I've been reaching with my heel. You could reach with the front of your foot. I just find it to be a little bit more comfortable for myself to reach with my heel. Again, 3 sets of 8 is what I'd be aiming for, and really controlling. I'm tapping down and coming up. I'm not putting all of my weight on that front foot. I'm just touching and coming up. This is gonna challenge my ability to not just rotate as I reach forward. So if you feel yourself twisting, just don't reach as far forward. At some point, the step might be too low to really reach, so you'll have to work with that, but adding some weight, especially if I had weight in this hand of the same side that's coming forward, that would really challenge my ability to maintain this. If it's on the side where the leg's down, my left side in this case, it wouldn't be as difficult as if it's on the opposite side. For the tempo step down, you're really honing in on like tendon strength and integrity in your patellar tendon, and you're really exaggerating that strength. You are going to need to really control the down, pause at the bottom, and then just come up. So generally you could do like a 3, 2, and a 1, or 4 seconds down, 2 seconds pause, 1 second up. The tempo you could apply to any of these different varieties of step downs. I'm gonna just use the regular standard step down, but basically I would count 4, 3, 2, 1, 1, 2, 1. So 4, 3, 2, 1, 2, 1. Now on that 1, 2, that pause at the bottom, you wanna make sure you're not just stepping down and putting your weight there. You want to just kind of lightly have pressure there. I'm just hovering and kind of touching and then coming up. So it's really a bit more of a hover than it is me stepping down. You can increase the length of time that you're spending on this, which will decrease the number of reps you're doing, because it would be a lot to do so many reps if you're spending, 7 seconds, 8 seconds, or whatever on each repetition. The importance of this tempo step down is really bulletproofing the tendon and really creating a lot of neurological control in this ability to lower down. A great question would be, how do you choose which step down to do? Or should you add weight, or how many sets and how many reps? And the most straightforward answer is, the thing that matters most is how well you can control the movement. And if you can really control without any issue the down and the up, then maybe you increase the height, or you increase the weight or the reps. And if no matter what, you are able to make it still look easy, that's when you start adding these different varieties of step downs in. So if your control's looking really good, if your pain's remaining below like a 2, if you can master the movement and what your knee should look like, meaning it should stay forward of your toes of that same foot and not be collapsing in or too far out. It should look like you have mastered the movement. If you can do all that, then you can progress to the lateral, to the forward, and to the tempo step down. Thank you for watching this all the way through. I appreciate you listening to my ranting. If you're ready to take another step or maybe go to the next level, we have programs that we've already made, and we are also willing to make custom programs as well as do virtual consults. If you think that what you're dealing with deserves its own separate moment, just reach out to us. We'll provide everything you need in the links below. Feel free to ask any questions, and if we feel that the only way we can best help you is by actually working more directly, we'll make sure you know. Otherwise, we will answer everything we can. I'm Doc John from Mobility Doc. Thank you for watching.